the salt habit that can make your blood pressure swing. Most people think blood pressure only rises because of stress. A bad day, a scary phone call, too much coffee, not enough sleep. A little anger, a little worry. And yes, stress can raise blood pressure. But here is where people get fooled. One of the biggest reasons blood pressure swings up and down may be sitting quietly on your plate every day. Salt. But not in the way most people think. The real problem is not simply that you sprinkle a little salt on your eggs. The bigger problem is the habit of eating large amounts of hidden sodium at certain meals, especially from packaged foods, restaurant meals, sauces, snacks, deli meats, soups, breads, frozen dinners, and takeout, and then wondering why your blood pressure feels unpredictable. One day your reading looks fine, the next morning it is high, then it drops again. Then after a restaurant meal it jumps. Then you feel puffy, thirsty, heavy or headachy. And you think, why is my blood pressure so unstable? This is where salt can fool you, because sodium does not always affect blood pressure like a light switch. For many people, especially after 50 or 60, sodium can behave more like a pressure wave. You eat a salty meal, your body holds more water to keep sodium balanced, blood volume may increase, blood vessels may become less relaxed, and blood pressure can rise hours later or even the next day. The American Heart Association explains that excess sodium can lead to high blood pressure, and the average American diet gets almost twice as much sodium as recommended. The CDC also notes that eating too much sodium can increase blood pressure and raise the risk of heart disease and stroke, and most sodium comes from packaged and restaurant foods, not the salt shaker. That last part matters, because many people say, I don't eat much salt, but what they really mean is, I don't add much salt. Those are not the same thing. You may not use the salt shaker at all, but if lunch is a sandwich with deli meat, cheese, chips and bottled dressing, that can be a sodium-heavy meal. If dinner is soup from a can, frozen pizza, takeout noodles, restaurant chicken or a store-bought sauce, that can be a sodium-heavy meal. Even foods that do not taste extremely salty, like bread, tortillas, cereal, cottage cheese, pickles, salad dressing, canned beans and marinades, can add up quickly. And this is why blood pressure can swing. It is not always one dramatic salty food. It is sodium stacking. Sodium stacking means small sodium sources pile up across the day until your body has to manage a bigger load than you realize. A little in breakfast, a little in bread, a little in lunch meat, a little in sauce, a little in snacks, a little in dinner. Then by night your body is carrying more sodium than you thought. After 50, this becomes more important because the body may become more salt sensitive. Salt sensitivity means blood pressure responds more strongly to sodium intake. The kidneys may not clear sodium as efficiently as before. Blood vessels may be stiffer. Hormones that control fluid and pressure may respond differently. High blood pressure, diabetes, kidney changes, sleep apnea, and certain medications can make this even more important. Most people miss this because they expect salt to cause symptoms immediately. But high blood pressure is often silent. You may not feel your pressure rising. You may simply wake up with a higher reading, feel a little flushed, feel pressure in the head, feel thirstier, notice rings fitting tighter, or see ankle puffiness. And sometimes you feel nothing at all. This is where people get fooled again. They check blood pressure randomly, see one high number, panic, then check it 5 more times. But they never connect it to yesterday's salty meal, poor sleep, alcohol, pain medicine, dehydration, or stress. Your blood pressure reading is not just a number from that moment. It is often the result of what your body has been handling for the last several hours. The first part of the salt habit is eating the saltiest meal at night. This is extremely common. During the day you may eat lightly, maybe toast, coffee, a small lunch, something quick. Then dinner becomes the biggest meal. Takeout, restaurant food, frozen meals, soup, sauces, processed meats, chips or salty snacks while watching TV. Then you go to bed. While you sleep, your body has to regulate that sodium load. It may hold water, you may wake up thirsty, you may wake to urinate, your face may look puffy, your fingers may feel tight. Your blood pressure may be higher in the morning. And this matters because nighttime should be the time when blood pressure relaxes. In healthy sleep, blood pressure usually dips. But if the body is dealing with sodium overload, poor sleep, alcohol, sleep apnea or stress, that normal dip may be weaker. So the evening salt habit can quietly steal the recovery window your blood vessels need. A practical takeaway is simple. Do not make your saltiest meal your last meal. If you are going to eat restaurant food, processed food, or anything sodium heavy, try not to pair it with late night snacking, alcohol, and poor sleep. Better yet, reduce the sodium load by choosing grilled, fresh, unsauced, or lower sodium options, asking for sauces on the side, and adding vegetables, beans, or whole foods that bring balance. The second part of the habit is trusting healthy packaged foods without checking sodium. This is a big one. Many people switch from obviously unhealthy food to foods that sound healthier. Turkey slices, vegetable soup, whole wheat wraps, cottage cheese, protein bowls, low-fat frozen meals, veggie burgers, canned beans, salad kits, bottled sauces, hard healthy crackers, natural broths. Some of these can fit into a healthy diet, but some are loaded with sodium. This is where people get fooled by the front label. The front says low fat, high protein, organic, gluten-free, plant-based, or light. But your blood pressure does not care about marketing. It cares about sodium load, potassium balance, calories, fiber, and the overall pattern. A soup can look healthy because it has vegetables, but it may carry a large sodium dose. A wrap can look clean, but the tortilla, meat, cheese, and dressing can stack sodium fast. A salad can seem safe, but the dressing, cheese, croutons, olives, and processed toppings can push it higher than expected. Most people look at sugar and calories first. For blood pressure, you also have to look at sodium. The American Heart Association recommends no more than 2,300 milligrams of sodium per day and says an ideal limit is no more than 1,500 milligrams per day for most adults, especially people with high blood pressure. It also notes that cutting about 1,000 milligrams per day can improve blood pressure and heart health. That does not mean everyone has to become obsessive, but it does mean you need awareness. If one meal has 1,200 or 1,800 milligrams of sodium, that meal is not light for blood pressure just because it looks small. The third part of the habit is adding salty flavor at every stage. Salt in the cooking, salt in the seasoning blend, salt in the sauce, salt in the cheese. This is how sodium becomes invisible. You may not taste it strongly because your taste buds get used to it. Over time, normal food starts tasting bland unless it is heavily seasoned. And after 60, taste and smell can change. So some people add more salt just to get the same flavor. This is where people get fooled. They think I only added a little, but the food was already salty before the shaker ever showed up. A better strategy is not to eat flavorless food. That will not last. A better strategy is to change the kind of flavor. Use garlic, onion, lemon juice, vinegar, black pepper, herbs, salt-free seasoning blends, paprika, cumin, oregano, basil, ginger, chili, or fresh salsa without heavy sodium. Let acid herbs and spices do some of the work. At first, food may taste different, but taste buds can adapt. Many people find that after a few weeks of eating less sodium, heavily salted food starts tasting too salty. That is a good sign. It means your palate is waking back up. The fourth part of the habit is reacting to high blood pressure by cutting salt for one day, then going back to the same pattern. This creates the swing. You see a high reading, so you behave for one day. You eat plain food, you drink water. You avoid snacks. The number improves. Then you relax and return to processed lunches, salty dinners, sauces, restaurant meals, and late snacks. The number rises again. Then you think your blood pressure is mysterious. But the body is simply responding to inconsistency. Blood pressure usually improves with patterns, not one-day punishments. Your blood vessels and kidneys need a steadier environment. If sodium is low one day and very high the next, your readings may look unstable, especially if you are salt sensitive. This is why the goal is not a dramatic no-salt challenge. The goal is consistency. A steady lower sodium pattern is often more powerful than a perfect day followed by 5 salty days. The DASH eating plan is built around a balanced pattern of vegetables, fruits, whole grains, low-fat dairy, fish, poultry, beans, nuts, and vegetable oils, while limiting foods high in saturated fat and sugar-sweetened beverages. It is not a crash diet. It is a structure that supports blood pressure because it improves the overall food environment, not just one ingredient. And this is where potassium matters too. Potassium helps balance some of sodium's effects in the body. Many fruits, vegetables, beans, lentils, potatoes, yogurt, and other whole foods contain potassium. But this needs to be personalized. If you have kidney disease or take certain medications, especially some blood pressure medicines, potassium can become risky if too high. The American Heart Association notes that some salt substitutes contain a lot of potassium and should be discussed with a healthcare professional if you have kidney disease or take certain medications. So do not blindly replace all salt with potassium salt. That may be helpful for some people, but not safe for everyone. The smarter move is to ask your clinician if potassium-based salt substitutes are appropriate for you, especially if you have kidney disease, heart disease, diabetes, or take ACE inhibitors, ARBs, potassium-sparing diuretics, or other medications affecting potassium. Now let's talk about why salt can make blood pressure swing more after 50. Your kidneys help control sodium and water. When sodium intake rises, the kidneys work to remove the excess. But if the kidneys are slower, if blood vessels are stiff, if hormones are activated, or if blood pressure is already high, the body may hold on to more fluid for longer. More fluid in the bloodstream can mean more pressure against artery walls. Stiffer arteries do not absorb that pressure as smoothly, so the number can rise. And if this happens again and again, the blood vessels are repeatedly exposed to higher pressure. Over time, that can contribute to more vascular stress. This is not about fearing salt, as if one salty meal ruins your health. The body can handle occasional changes. The problem is when the occasional salty meal becomes the daily pattern. This is why one person can eat salty food and seem fine, while another person sees a big blood pressure jump. People differ. Age, genetics, kidney function, body weight, diabetes, sleep quality, medication, and baseline blood pressure all matter. Most people miss this. They say, "My friend eats salt and his pressure is fine." But your body is not your friend's body. Your blood vessels, kidneys, and hormones may respond differently. The only reading that matters is yours. So how do you know if salt is affecting your blood pressure? Track the pattern. Not obsessively, just intelligently. For 1 or 2 weeks, measure blood pressure at consistent times using proper technique. Sit quietly for 5 minutes. Keep your feet flat. Support your arm at heart level. Avoid caffeine, exercise, nicotine and stress right before measuring if possible. Take 2 readings, 1 minute apart, and write them down. Then write down the sodium clues: restaurant meal, packaged soup, deli meat, salty snacks, frozen dinner, pizza, canned food, sauces, alcohol, poor sleep, pain medicine, or late eating. You may start seeing the truth. Maybe your pressure is higher the morning after takeout. Maybe it rises after soup and crackers. Maybe it jumps after salty dinner plus alcohol. Maybe it improves when you cook at home for 3 days. Maybe it swings less when dinner is earlier and lighter. That pattern is valuable, because once you see the trigger, you stop blaming your body blindly. Now, here is what not to do. Do not stop blood pressure medication because you want to fix it naturally. Do not take extra medication because one reading is high unless your clinician told you exactly what to do. Do not cut sodium to extreme levels without guidance, especially if you are on diuretics, have heart failure, kidney disease, adrenal issues, or are prone to low sodium. Do not use salt substitutes without checking if they are safe for you. This is where people get fooled by extremes. One side says salt does not matter at all. The other side says salt is poison. The truth is more useful, sodium is necessary. But too much sodium, especially in a salt-sensitive person, can raise blood pressure and make readings harder to control. The goal is not zero sodium. The goal is the right amount for your body. Start with the biggest wins. Replace deli meat lunches with fresh chicken, tuna, eggs, beans, or leftovers when possible. Choose low-sodium soups or make soup at home. Rinse canned beans and vegetables. Ask restaurants for sauces and dressings on the side. Choose grilled instead of breaded or sauced. Swap salty snacks for fruit, unsalted nuts if appropriate, yogurt, vegetables with hummus, or homemade options. Use herbs and acid instead of relying on salt. Read labels on bread, tortillas, sauces, and frozen meals. And avoid stacking multiple salty items in the same meal. That last one is powerful. If you want bread, keep the filling lower sodium. If you want cheese, skip deli meat. If you want sauce, use less processed meat. If you eat restaurant food, make the rest of the day simpler. If dinner is salty, do not add chips, pickles, and alcohol on top. Blood pressure often swings when sodium is stacked without awareness. And after 50, awareness becomes a form of protection. Also remember that salt is not the only trigger. Poor sleep, sleep apnea, stress, pain, alcohol, caffeine, dehydration, obesity, kidney disease, and certain medications can all affect blood pressure. But sodium is one of the triggers you can often change quickly once you learn where it hides. And that is the good news. You do not need a perfect diet to improve the pattern. You need fewer sodium surprises. Your blood pressure wants steadiness, steadier meals, steadier sleep, steadier hydration, steadier movement, steadier medication timing, steadier sodium intake. So if your blood pressure has been swinging, do not only ask, "Am I stressed?" Ask, "Did I stack sodium yesterday? Did I eat processed meat? Did I use bottled sauce? Did I order takeout? Did I eat soup, bread, cheese, and chips in the same meal? Did I eat salty food late at night? Did I drink alcohol with it? Did I sleep poorly after it? Did I check my blood pressure the next morning and act surprised? This is where the answer may be hiding. The salt habit that can make your blood pressure swing is not just using the salt shaker. It is eating hidden sodium in waves, especially from packaged and restaurant foods, then being inconsistent from day to day. And once you see that, you can change it. Not with panic, not with bland food, not with extreme restriction, but with smarter choices, steadier meals, label awareness, better seasoning, and a pattern your kidneys and blood vessels can trust. Because high blood pressure is often called silent for a reason. It may not warn you loudly, but your numbers may be telling you a story. And sometimes the story is simple. Your body is not overreacting. It is responding to the salt you did not realize was there.